Okay, everyone, welcome. We're going to go ahead and get started. I just wanted to welcome everyone, and we're extremely excited to have everyone here for the Lead-Free Utah Conference. For those that don't know me, my name's Claudia Fruin, and I founded the Utah Lead Coalition, and what we are is really a group of public and private partners that are just working together to try and build awareness about lead and to increase testing. I spent 26 years as a community pediatrician in private practice, and my confession to everyone here today was that I did a really bad job of testing kids for lead exposure, even those I was supposed to test. So the kids on Medicaid who should be tested at age 1 and 2, and kids going to Head Start. And I didn't do a good job of asking families about lead exposure, even though we were supposed to do that from age 6 months to 6 years. That was a recommendation. So I think I did it when I first moved to Utah 30 years ago from Illinois. I think I tried to do a really good job early on, and then there weren't a lot of elevated lead levels. There wasn't point of care testing, so it was, I would hand the parents an order to get a venous blood draw, and they didn't really do it, and I didn't really think about it, and if they did do it, it probably wasn't that high, or I didn't know what to do with it, so I just sort of stopped doing it, and it just sort of fell off my radar. So like a lot of you probably, my epiphany about lead hazards really came after the Flint, Michigan water crisis, and at that time, or shortly after that, I was serving as a medical director for children with special health care needs at the Utah Department of Health in 2016 and 17. And then the other thing that happened was because of Flint, my national organization of professionals, the American Academy of Pediatrics, came out with a policy statement saying that we as pediatricians need to do a better job of testing children about lead exposure. The problem hadn't gone away, and we just needed to do a better job. And a couple things hit me was that their estimate that 2.6% of the preschool age children in the US had blood levels greater than or equal to 5 micrograms per deciliter. And another thing they said was that about 20% of ADHD children, their ADHD may be attributed to lead exposure. And so those things were frightening to me. I wondered how many kids I'd missed. I seemed to be like a magnet for ADHD kids, and I never even ever tested them. It never even entered my mind. So I just felt the need to figure out what was going on in Utah. So I figured out how to look up our state lead plan, and I found out that we had really very little data on our kids. And so I realized, I guess, other doctors were like me. They weren't testing kids. And so I knew as a pediatrician, we're more than anyone else know that we're supposed to screen for developmental delays, but were we even ever considering lead exposure as a cause of that? Because I sure wasn't. And these are the realizations I came to. Number one, if we didn't test, how were we going to know if there was a problem here? Number two, if we didn't test, how are we going to prevent further exposure? And number three, if we did not test, when a child was diagnosed later with a learning disability or a developmental delay, could it have been prevented if we had decreased their exposure early on when they were younger? So I recently read a book called Lead Wars, and they pointed out a couple other things that I hadn't really thought about, especially as they related to the medical field. And so, unlike a lot of other poisons that we learn about, whose acute effects disappear when the elimination of the poison is taken away, lead's effect on the child's brain is immediate, it's often permanent, and except in very rare acute cases, the symptoms are not obvious or immediate, so they're delayed. And another thing that I thought was interesting was that if the serious consequences of lead poisoning had been linked to an infectious disease like influenza or meningitis, there would have been a broader national effort to eliminate the epidemic. So it was obvious Utah needed a concerted effort to increase lead testing and reporting, and hence our coalition was formed. So why did we start? There was a need because You know, when I looked at this in 2016, our state-led plan still defined elevated lead is greater than or equal to 10 micrograms per deciliter. And this was despite the fact that in 2012, the CDC had changed that definition or recommendation down to 5. So we were still following old standards. Another important thing in our state was that we don't require testing for kids, except kids on Medicaid and Head Start. There's about 180,000 kids on Medicaid, and only about 20% were being tested and reported when we first started looking at the data. So we're called a targeted testing state, meaning we're supposed to do the Medicaid kids who live in homes built before 1950, that sort of thing, but it's not required. Another reason, as you all know, is we have a lot of births in our state. We have 52,000 births a year. And when I looked at the data, the latest data was in 2015, and there was only about 3,000 blood lead levels reported in all kids in our state under 5 years and under, which is only about 1% of our population of, say, 260 to 270,000 kids in that age category. We also are a state that has a lot of old homes. 58% of our homes were built before 1978, when lead paint was actually banned. And then another important thing, and certainly this pertains to me, was that medical providers didn't know that all of these lead levels were supposed to be reported in our state. So if they did it in their office or if it was done in a lab, everything was required to be reported to the state, and that included a lot of demographic information. So the name, the birth date, the family's name, the address, all of this stuff. I had no clue about that. And when I did a survey on doctors, or pediatricians, I should say, it seems like most of them did not know that either. So how we started this whole thing. So first of all, I was, again, working for the state. I asked Dr. Miner, who was executive director physician of the Utah Department of Health, if I could work on this, and he said, go for it. And then we had very strong support from the environmental epidemiology leaders. Mark Jones, raise your hand, Mark. Mark Jones in the back was very, very helpful and supportive of trying to get things done. So just found a bunch of anybody I could think of, interested state, county, and private partners. Held our first meeting about 2 years ago, and then have met every 2 months ever since. After the first meeting, and there was wide support to keep this going, we made our first goal to change the definition of what elevated lead was in our state from 10 down to 5 micrograms per deciliter. And we had other goals, which were to just increase awareness in our state, increase testing, increase reporting, and develop some like Utah-specific materials that all medical providers and state agencies, everybody could use, so families was getting the same information from everyone, because there was a lot of variation in information that was received. Within 6 months of really having this coalition together, we'd actually attained the 3 grants mentioned, so the AAP, CDC, and the EPA grant. And I always tell people, you don't get grants really unless there's a need. So there was definitely a need in our state for improvements. Ooh, it's raining really hard. So we accomplished our first goal about 9 months into the coalition, and that was the injury reporting rule for our state was revised, stating that elevated cases of lead include everybody with blood lead concentrations greater than or equal to 5 micrograms per deciliter. So prior to this change, only people with 10 or above in our state required case management. And then Department of Epidemiology in December of 2017 sent out letters to Utah physicians notifying them of the changes. And it's really important because now this has affected how local health departments follow up and manage elevated blood lead levels. So it's important to know that though you're required to report every lead level to the State of Utah Epidemiology Program, for those 5 and above, it's actually the local health departments who do case management. So it will be mostly your county health departments that will follow up on the elevated levels. Other things that we've accomplished. So we've developed materials, and pretty much all of the materials that we've developed as a coalition, there are copies in your folders here today. So there's posters, there's exposure questionnaires. We developed a testing and treatment guideline, a dietary guideline, a guideline for parents whose child has elevated lead levels. So if it's done in the office, you actually have something to give to the parent that explains what follow-up is recommended, and then a lead avoidance pamphlet as well. We were able to develop a website, utahleadcoalition.org, and this was thankfully through the DEQ lead-based paint program. And our website houses all of our information as well as other resources. It's really great. I think it's a really good one, and we keep it updated, and they've been awesome to work with. Anytime I contact them, they'll put new information on there. I've been able to educate over 250 medical providers on the importance of lead testing and reporting. Utah Physicians for a Healthy Environment and the Lead Safe Housing Program have done so many outreach events. They've done them in high-risk and refugee communities, school classrooms, and community councils. So importantly, since we started this, we've actually tripled the number of blood lead tests that have been reported in our state. Our latest data from 2017 was about 10,000, so we went from less than 3,000 to 10,000. And Mark Jones, the epidemiologist in the back, just told me preliminary data in 2018 shows that it's gone up, in 2018, and we anticipate, we'll talk about that we'll get a lot of data in 2019. And then another huge accomplishment that Dr. Liz Harris is going to talk about in a little while was through efforts and meeting the right person, we've been able to get Intermountain to set as a goal of testing all of their children age 1 and 2 in 2019, and I believe this is now spreading to the family practice community at Intermountain as well. And then finally, we have this Lead Coalition, Lead for Utah Conference. I just wanted you to take a look at all the people that have been involved with making these changes and come to meetings. It's really important. Utah Baby Watch Early Intervention. We did not have lead poisoning on one of the automatic qualifiers for services through Baby Watch Early Intervention. We've been able to make that happen in the last 2 years. So now any child with a level above 10 automatically qualifies without evaluation for services through Baby Watch Early Intervention. So you can look and see all the other people that are really involved as partners. And importantly, some of the things that are currently in the works. So my original idea was that we would be able to get lead data to be able to be entered into USIS, the Utah State Immunization Information System, because pediatricians, doctors open that all the time for vaccines for kids. But that's not going to happen because of a change in the way the state is trying to integrate all immunization information now into EMRs. So the goal is to work with the Department of Health Informatics team and the organization called Utah Health Information Network, UHIN, to pilot a process for each individual EMRs, of which I know there's many, 7 or 8 or whatever, to figure out how we can integrate they're entering their lead data so it goes directly to be reported to the state. And so those of you especially that are going to participate in the Part 4 Quality Improvement Project, and you have different EMRs, we want to have UHIN people meet specifically with your practice so we can figure out how to make that happen for you. So to me, that's huge. Another important thing, I approached my legislator, Senator Janie Iwamota, originally asking her, could she sponsor a bill that would require testing of all children in our state, let's say before age 3. And what we kind of came up with, at least with the first year, which I think is logical as we gather data, is that this has pretty much already been written, but we're sponsoring a resolution to increase awareness on the importance of lead testing in children and pregnant women. So that will be presented this legislative session in January. And then this final thing is going to be very interesting. There's been a graduate student working for the last year and a half named Josie Tabor, and she's her project is to gather 20 years of data from Salt Lake County, and she's gathering the lab data from Intermountain and the University of Utah over the last 20 years of lead tests that were done, and she will figure out where the high levels were, and high now being 5, and things that were missed in the past, and be able to map some of that data and give us some guidance on where the problems are. And then just a few things, just things we have learned, and I think that are really important, and why this conference is important. In the latest year, we have data, only 3% of children 5 and under were tested and reported in our state. And of the kids tested and reported in the last 2 years of data, around 2% of them actually have levels 5 and above. And we'll hear later from a water person, Luke, but there was a couple years ago a voluntary school water testing program, and they found that 3% of, I think it was about 700 of the 1,000 schools actually had elevated lead levels in it. Another thing that we've learned is all the local health departments, who are the ones that case manage the lead levels, there's a lot of variation in what kind of resources they have. So I think Salt Lake County is probably for sure the best equipped, as far as case management and stuff. And so we want to make sure that we can, everybody can manage their elevated lead levels as best as possible. And another thing that I really learned was that we needed to continue to improve communication between the local health departments, the case managers, and the doctor's offices who are doing the testing, because they're telling them different things. They're not they're not communicating with each other, and it could just be a simple phone calls like, we've got your kid that has this elevated lead level, this is our plan, and they work together. So that to me is extremely important. And then I just wanted to tell a few stories that I've heard over the last couple years that I thought were interesting. So I think this one came out of Davis County, and there was the mom actually asked to have her child lead tested. She was a Medicaid patient, and they did it. They found it was elevated, and then tried to figure out where it came from, and it turned out this little kiddo was going to like a grandparent's home, and they had a bucket of bullet casings and sucking on the bullets. So, and then there was a dad in Utah County who worked at a rifle range, and this child was just routinely screened at age 2, found to have an elevated lead level, I think it was about 9. They tested the whole family, which is what you're supposed to do when you have a elevated confirmed level, and the dad was 40-something, and he had no idea that was a problem, but he worked at a rifle range. And so everybody in the family had some level of lead, but he was bringing the lead home because they lived in a newer home. There was no other exposure on his clothing, shoes, what have you, touching the kids. That's how that happened. And then really important with home renovation, so a 3-year-old found to have elevated lead through a home renovation. And I remember being at a community council meeting, and a mom came up like almost in tears afterwards because her child's level was 4. And again, she had to ask for it to be tested, and she thought she'd ruined the kid's life. And she said, I'll never forgive myself for renovating this house. And so, so that's some stuff I've learned. And then I just thought this was, if someone knows me and other things I'm involved in, I thought this was really funny. So anyway, that's that. My contact information.